Welcome to the Megacast. I'm Tyler Keefe in the studios of our flagship stations, Civic Center TV and 89.3 Lakes FM. Civic Center TV is on Comcast Channel 15 and AT&T Channel 99 in the Oakland County area, and as well as on Birmingham Area Municipal Access, also Comcast Channel 15 and AT&T Channel 99. We're on the radio, of course, as I said, 89.3 Lakes FM, and we're also on in the Birmingham Bloomfield area on 88.1 WBFH, The Biff. Find us online each day live from 10 a.m. to 12 noon on civiccentertv.com by clicking on our Watch Live link or viewing us in that small player at the top right of the homepage on your web browser on your computer. You can also find us on civiccentertv.com on your mobile phone by scrolling to the left side of the page into our menu and clicking on Watch Live, or you can watch us during the Megacast, during our replays, and all of our other programming throughout the afternoons and evenings, 24 hours a day, 7 days a week. Another place to find us online is on My Michigan Television, mymitv.com to learn more, mymitv.com, and that's also on your smartphone and your smart TV. The My app can be found on the Apple App Store. It can be found on the Android App Store as well as on Google Play. You can find it on Android TV, Fire TV, Roku TV, Apple TV, and other smart TV devices as well. It's My Michigan TV, Michigan's streaming network. mymitv.com, and you can also find us each and every day from 10 a.m. to 12 noon on our Facebook pages, Civic Center TV 15 and Facebook.com/Civic Center TV /Lakes FM for our Lakes FM Facebook page. And then on our website, civiccentertv.com/Megacast, or by clicking on our Megacast link on our homepage. That'll take you to more information that you can find about our partnering stations, as well as links to all of our interviews and all of our full episodes from every single edition of the Megacast, all the way back to March of 2020. You can watch any episode and any interview up there on our website, civiccentertv.com/Megacast, because we get it. Some of you can't be with us for 2 hours every single day live from 10 a.m. to 12 noon, but you want to spend 2 hours with us every day. You want to stay informed about what's going on with COVID-19 and other important information here in Oakland County and throughout the state of Michigan. You want to do it on your own time, you can do that. civiccentertv.com/Megacast. Scroll down and click on Watch Full Episodes. Some of these interviews may not be of interest to you, and others may be of great interest to you, so you can pick and choose which ones you want to watch as well. Individual interviews by clicking on Watch Full Interviews. Again, civiccentertv.com/Megacast. And then on civiccentertv.com/Coronavirus, we have helpful information about COVID-19 and other news in the local area as well. And this is the most important thing, I would argue, on this page. Links to reputable resources about COVID-19 information, whether that be vaccines, whether that be mask wearing, whether that be the COVID-19 metrics in your local area here in Oakland County or throughout the state, or national numbers as well. We have direct links to the COVID-19 pages of the Centers for Disease Control and Prevention, the State of Michigan's Health and Human Services Department, as well as the Oakland County Health Division, and many of our local municipalities here in the Oakland County area as well. So if you're a West Bloomfield Township resident and you go to our webpage, civiccentertv.com/coronavirus, and click on West Bloomfield Township, it takes you directly to their COVID-19 information page, which will have more specific information about how COVID-19 is affecting operations in West Bloomfield Township. Same thing goes for you residents out in the city of Auburn Hills, or in Pontiac, or in Rochester, and many of our other municipalities in Oakland County. civiccentertv.com/coronavirus, where you'll also find our top stories today. As Governor Whitmer says, there are no plans to do any broad mask mandates around vaccines or masks in schools. This is from the Detroit News. Governor Gretchen Whitmer is not considering a COVID-19 vaccine mandate for state workers now that the U.S. Food and Drug Administration, or FDA, officially granted the first full authorization Monday of a coronavirus vaccine, that, of course, of the Pfizer-BioNTech vaccine. In a quote from the governor on Monday, she says, quote, "There are no plans to do any broad mandates," referring to her decision not to mandate vaccines or require masks at Michigan schools. The governor continued, "Those who are uneasy because of early use authorization status of the vaccine maybe now will have a greater confidence in the fact that these vaccines are safe and they work." and closed quote. This is the latest in a series of statements from Governor Whitmer or members of her administration that have made to rebuff the idea of a new pandemic regulation in Michigan. While the governor and state health department leaders have argued mask mandates and capacity restrictions saved lives in the first month of the pandemic, since January, the Whitmer administration has promoted a message that revolves around personal responsibility, much like that of her opponents who previously during the pandemic had been vehemently against her regulations and mandates that were in place to prevent the spread of COVID. That's left some school leaders and parents frustrated and afraid. Some districts are mandating masks, but the majority of Michigan's school districts are not. In the early days of the pandemic, when almost all schools were offering only remote education, there were a few reports of children hospitalized due to COVID-19. But the number of children in the hospitals sick with the virus has risen drastically in recent weeks in parts of the country where the Delta variant is raging. The FDA's full approval of the Pfizer vaccine to be marketed under the name under a different name, is for use in Americans ages 16 and older. For those 12 to 15, the vaccine still has emergency use authorization, and the vast majority of experts agree it is safe. But kids under the age of 12 still cannot get the vaccine, and that makes them more vulnerable to infections. The governors of New Jersey, Washington State, California, Hawaii, and New York, as well as the mayor of the District of Columbia, have put some form of a COVID-19 vaccine mandate in place, whether it's for public sector employees, healthcare workers, or teachers. In some places, all three classes of workers must either get vaccinated or submit to weekly testing. Federal employees must also attest to being fully vaccinated or undergo frequent COVID-19 tests, and the U.S. military is expected to issue a full vaccine mandate as well. Whitmer's goal was to get at least one dose of coronavirus shots into the arms of 70% of the state's 16 and older population, but the state has yet to reach that benchmark despite incentives that included a statewide lottery raffle system that began in July. As of Monday, the state's vaccination rate stood at 65.2%. That's below the national rate of vaccine uptake, which is currently at 73%, according to the CDC. And a quote from Governor Whitmer again, the people that are getting COVID and needing to be hospitalized are overwhelmingly the unvaccinated. She continued, so anyone who's been waiting to see if this vaccine gets full approval now knows that it did, and we are hopeful that they will go and get vaccinated, and closed quote. From January to July of this year, the unvaccinated Michiganders accounted for 98% of COVID-19 cases, 95% of hospitalizations, and 96% of deaths, according to the Michigan Department of Health and Human Services. So, despite the situation as it stands in Michigan, and despite the governor and her administration's stand on COVID-19 spikes earlier on in the pandemic, she has assured the people of Michigan mask mandates, vaccine mandates at the state level will not be put in place for state workers and for schools and for teachers and for so on and so forth, which is contrary to many other governors and of course the mayor of the District of Columbia, as was marked in this article, my apologies, who have put mandates in place. Governor Whitmer's taking, once again, as it's marked in this article from the Detroit News, a personal responsibility model and saying she's not going to require schools to put mask mandates or vaccine mandates in place. The Centers for Disease Control and Prevention may have a little bit of a contrarian stance to that, as they say all but 2 Michigan counties should mask up. This also from the Detroit News. COVID-19 transmission is high enough in all but 2 of Michigan's 83 counties that an overwhelming majority of Michigan residents should be wearing masks while in public under federal guidelines, according to the latest data from the Centers for Disease Control and Prevention. People who live in areas that are high or substantial number of COVID cases should wear masks in public, indoors, or outdoors if social distancing is not possible to prevent the spread of the Delta variant. The number of counties that meet the threshold climbed from 33 on August 3rd when the new CDC guidance was announced to 81 as of Saturday, according to CDC data. Mississauga and Roscommon counties, which sit next to each other in the northern Lower Peninsula, are listed as having moderate rates of community transmission on the CDC's COVID-19 tracker, which you can find a link to by navigating our webpage, civiccentertv.com/coronavirus, and clicking on the CDC resources. No Michigan counties have a low rate of transmission at this time. In comparison, 3 weeks prior, 7 of the state's 83 counties were considered low rates of transmission. 44 were considered moderate, meaning the CDC was recommending fewer than half of all Michigan counties wear masks in public. Only 6 counties at that time had high transmission rates. Again, now at this moment in time, 81 of 83 counties, high or substantial COVID-19 transmission, according to the CDC. That matches the trend seen nationally as the Delta variant has spread across the country. Most states have been marked as high transmission communities. Many states, including Indiana in the Midwest and nearly all of the states along the Gulf Coast, are ranked as being entirely high transmission. The places in the U.S. that are still considered low transmission are among some of the least densely populated. That includes rural counties and places like Idaho, Nevada, and Nebraska, some of which only have a few thousand, or even a few hundred people living in several hundred square miles, according to 2020 U.S. Census data. The Centers for Disease Control and Prevention also recommended indoor masks for teachers, staff, students, and visitors at schools nationwide, regardless of vaccination status. As we've said, Governor Whitmer on Monday defended her decision to forego a statewide mask mandate, arguing Michigan finds itself in circumstances that are much different than last year when executive orders were one of the only options available to protect people. Now that there are vaccines and better mask and social distancing guidelines, she told reporters at a Monday press conference and said, therefore, we don't need to have these more stringent requirements in place. But Michigan State University epidemiologist Dr. Nigel Paneth, who we've had on this show before, an emeritus university distinguished professor of epidemiology and biostatistics and pediatrics, said it's clear people need to go back to masking. In a quote from the good doctor, he says, "We jumped the gun a bit in June when we said we don't need masks as of July 1. I think everybody was trying to accommodate the anti-maskers, and I think that was a mistake." Michigan on Monday reported 3,920 COVID cases and 10 deaths over 3 days. As a health association said, statewide hospitalizations tied to the virus have now exceeded 1,000 people. On Monday, amid ongoing concerns about more contagious Delta variant, the tallies from the State Department of Health and Human Services pushed overall totals to 933,394 cases and 20,123 deaths since the beginning of the pandemic in March of 2020. The state has reported 10,807 new cases over the last week, up 14% from the 9,467 cases disclosed over the previous 7-day recording period. Asked about the virus progressing from 33 to 81 counties with high or substantial transmission in 3 weeks, Paneth said he was not surprised. Dr. Paneth, in a quote, was quoted saying, "They're not masking, they're not vaccinated. And if you're not masking and not vaccinated, you're asking for trouble." So there's 2 arguments here. There's the personal responsibility model that's being taken by Governor Gretchen Whitmer, that's being taken in many other states, such as Florida, such as Texas, some of those other Gulf Coast states that are all marked by the CDC at this time as being entirely in high or substantial transmission rates from COVID-19. But then there's the other part of it as well, where if people are not taking those personal responsibilities, not distancing, not wearing masks, not getting vaccinated if it is deemed to be a safe and effective option for them, or that they're not deemed to have a medical or a religious reason to not take the vaccine, that if they're not taking those personal responsibilities, more action should be taken. So even here in the state of Michigan, where 2 people that very much believe in the strength and the power and the danger of COVID-19, being Dr. Nigel Paneth from Michigan State University and Governor Gretchen Whitmer, there still are contrary opinions, one person to another. Oakland University, however, has made their stance very clear. This from the Oakland Press, as Oakland University has announced that it's now mandating vaccines for all students attending in-person and other activities, in addition to all faculty and staff working on campus or at off-site locations. The move comes after the university decided earlier this week to mandate masks indoors but not vaccines, which drew ire from faculty members. In a quote from Dr. Ora Hirsch-Peskovitz, the president, to the Oakland Press, she said, "We've been constantly assessing the situation. What we've done today is an extension of the mandate initially in place months ago." She was referring, of course, to the school's spring decision to make vaccines mandatory only for students living on campus. Peskovitz said the university's decision was a response to the, quote, "staggering numbers of hospitalizations and deaths in Michigan," and closed quote, and nationwide in relation to COVID-19 and the Delta variant. University officials also pointed to the state's 7-day case average increasing 14% over the last week. In the state, COVID-19 hospitalizations are up 23% since August 9th, and deaths are up 41% since late July. In another quote from Dr. Peskovitz, the university president, quote, "There has been a rapidly rising rate of COVID infections nationwide, but also here in Michigan and particularly here in Macomb and Oakland counties." She continued, "Our concern is that the rate with which the Delta variant is affecting people, and especially young people, we were concerned we might not reach our goal of completing herd immunity in time to protect our campus community," and closed quote. Peskovitz then said the U.S. Food and Drug Administration granting full approval on Monday for the Pfizer vaccine also aided in the decision from Oakland University. It says it will continue to offer $100 to all students, faculty, and staff who upload their data to the portal, to their health portal. It also said it is working to expand the number of online courses to be available for students this fall. So Oakland University fully mandating vaccinations for their staff, for their faculty, and their students for the upcoming year. And with the proximity that we are to the beginning of the school year at our colleges and universities, that's where I would believe some of this frustration toward this mandate would come from, because in some cases people are going to have to go through those additional protocols for several weeks if they are at a point where, well, I have to get vaccinated to maintain my work with the university, to maintain my academics at the university, but that's going to be a several weeks process. You got to get the first shot. You got to wait 3 weeks between the first shot and the second shot. Then at this point, we're also talking about down the line booster shots that should be taken about 8 weeks later. That should be taken later on. These booster shots at this point for those that are immunocompromised, that should be taken later on, and so that causes some frustration, I'm sure, with students, faculty, staff, and others in the community at Oakland University who now are, in some cases, racing against the clock to get vaccinated so that they don't have to go through these protocols anymore, or are frustrated because they once again have to go through another school year with these protocols. But with the transmission rate here in the state of Michigan, with the COVID-19 situation that we're in, with the increased number of cases from over the past week, and the increased number in hospitalizations since late July, it's a cause for concern, and Dr. Peskovitz has made, and the board over at Oakland University have made their final decision. Good news for someone here in Oakland County, for one Bloomfield Township woman, as she won the $2 million grand prize in the My Shot to Win sweepstakes. The My Shot to Win sweepstakes giveaway, which began on July 1st and ended on July 30th, included $5 million in total prizes to vaccinated residents, including a $1 million prize, a $2 million prize, and 30 $50,000 daily drawings, equaling a combined total of nearly $500,000 in college scholarships for 9 students. The goal of the sweepstakes was to help encourage more Michiganders to get vaccinated against COVID-19 and push the state's vaccination rate closer to 70% for those 16 and older in the population. On Monday, Christine Duval of Bloomfield Township, an immigrant from Canada, was named the winner of the sweepstakes' $2 million prize. She said the money will help her family achieve, quote, the American dream, in close quote, and support the community with plans to donate a portion of the winnings to aid community mental health services. Quote, it is a cause very close to my heart, and closed quote. She continued, our family has been incredibly blessed by this unexpected windfall. We're very grateful to the state of Michigan and our fellow Michiganders for this great opportunity life has placed ahead of us. Winning a sweepstakes is never something that you plan. She's the mother of 3 children, she said, and her husband and two of the 3 children are all vaccinated. Her youngest daughter is 10 years old and not yet eligible. Duval and her husband were vaccinated in April at a facility in Southfield. So congratulations to Christine and to the entire Duval family there out of Bloomfield Township here, hopefully listening to us today on WBFH on the BIF, or watching us on Birmingham Area Municipal Access. And if not, we'll want to extend our congratulations one way or another, $2 million grand prize. And of course, love to hear that her family plans to donate some of that amazing and unexpected windfall to mental health charities locally to help, of course, with that ongoing crisis that we've been focusing more on because of the pandemic, but maybe haven't taken as great of a focus as we would like to on because of the issues at hand right now with COVID-19. So with that, we got a great show ahead of you today. We're going to be talking all about COVID-19, about masking, about the vaccine, about the boosters with Dr. Preeti Malani, the Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. Yes, I know. My green and white Sparty nature is a little antagonistic when it comes to those from down in Ann Arbor, but she's an expert. She knows this stuff really well, and it's important for us to get her take on these issues right now and the facts on these issues with all the misinformation that is spreading around right now and all the debate that's going on about mask mandates, about vaccines, about the boosters, and why it's so critical right now with the Delta variant out there, with the continued spread of COVID-19, that we take the right precautions to prevent this from continuing to track onward and onward and onward over time. So that's coming up next. We'll also have Karen Olex from the Oakland Schools Division of Special Populations at 10:40. At 11 o'clock, we'll be joined by John McNamara, the Vice President of Government Affairs at the Michigan Restaurant and Lodging Association. And then later on in the second hour, we'll be joined by a couple of women from Kayla Marie's Hope Services, as well as a couple of people from Audio Engineers of Detroit to wrap up our show in the 11 o'clock hour. That's all coming up, that and more. You're watching and listening to the Megacast.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources. Call 211 or visit 211.org. 211. Get connected, get help.
How does marijuana affect the teen brain?
Our brains are still developing into our 20s.
With regular use, marijuana can affect teen brain development.
It can affect our brain's circuitry and blood flow and impair thinking, learning, and memory function.
Which could hold us back from reaching our potential.
Don't let marijuana mess with your brain.
Get the facts at michigan.gov/drug-free.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. You know, being 27 and a mom and a wife and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
Welcome back to the Megacast. I'm Tyler Kieft here in our studios in West Bloomfield Township as we continue to be joined by a number of experts across Oakland County and the state of Michigan about COVID-19 and other top news and information that affects our area and affects us here in the Great Lakes state, especially COVID-19. And just a couple of corrections from our opening segment there with our news and our headlines. The new name of the Pfizer vaccine is Comirnaty. I slipped up a little bit on the name and frankly butchered it, so let me correct it. Comirnaty is the name of the vaccine, and I also had said 8 weeks between the second shot and the booster, and that is 8 months. I had believed it was eight months when I said that, and just wanted to double check my corrections so I can make sure that you know that it's 8 months between the second shot of the two-dose vaccine before you would be eligible, or it's recommended that you get the booster shot. And right now, it's only really eligible for those that are immunocompromised here in Wayne County, we know for sure, and then in other local areas that will begin to provide those booster shots in the coming days and weeks. We're pleased to be joined by our first guest today, who is an expert on COVID-19 transmission here in our local area and throughout the U.S. Dr. Preeti Malani joins us once again. She is the Chief Health Officer and a Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. Dr. Malani, thanks for being back with us.
Yeah, thank you for having me.
Appreciate having you on. So right now, we are currently being massively affected by the Delta variant of COVID-19, specifically in our local area and throughout the state of Michigan, as we've seen and I read in our first segment that just recently we had less than half of our counties were in higher substantial transmission. Now we're at a point where all but 2 counties in the state of Michigan, all but 2 of Michigan's 83 counties are in that high or substantial rate of transmission. With this Delta variant specifically, what is it about this variant of COVID-19 versus others that we've had in the past, like the UK variant, that makes it so much more transmissible and so much more threatening to our community at this moment in time?
Yeah, well, Tyler, I think you hit it perfectly, which is that the Delta variant of SARS-CoV-2 is more highly transmissible. And to put it in perspective, we talk about something called the R naught, which is the estimated number of people that a person would infect if they are infected. And with the case of the Delta variant, it is likely in the 5 to 8 range. And the Alpha variant, or the variant that developed in the UK, it was closer to 2.5. So just over the course of a few transmissions, that number can grow exponentially. And so this is, the transmissibility is one issue. And then the other issue is that although vaccines remain effective, they remain highly effective for severe illness and preventing hospitalizations and death, they don't prevent all breakthrough infection. And so the breakthrough infections are happening at a higher rate with the previous variants.
So in terms of the vaccines, a lot of people that have questions about the vaccines, they point to that, to what you just said. They point to the fact that you can have these breakthrough infections despite being vaccinated, and so they then turn to taking the point of view of, well, if you can still get COVID-19 despite being vaccinated, what's the point? Why is that? And so to answer that question for them, please, Dr. Malani, why, if they are still able to get COVID-19 despite being vaccinated, should they still consider getting vaccinated and go get the shot?
Yeah, absolutely. They should get vaccinated. The vaccines may not prevent all infection, although they prevent a lot of infection. And the breakthrough rate, it's difficult to know for sure, but we're still talking about small portions of people. It's not that everyone is developing breakthrough infections. And most importantly, Tyler, the way the vaccine is supposed to work is that it prevents severe infection, it prevents hospitalization, prevents death. And it may be that it also prevents you from transmitting as easily to other people, especially those who are vaccinated around you.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and a Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. And so, Dr. Malani, with what we have right now, that's the Delta variant, but we're also hearing about the Gamma variant starting to become a problem in Washington State. We've also heard a little bit about the Lambda variant. How soon after we have increased rates of transmission like we have right now, where we're seeing more cases of COVID-19 in the form of the Delta variant in the state of Michigan and really throughout the U.S., how long usually does it take for us to progress from one variant being a more dominant variant to another one? And what are some of the risk factors that come along with that transition from one dominant variant to the next?
So Tyler, something that gets lost in all of this is that this is a novel coronavirus, which means that we haven't experienced it before, and that means that we don't know everything about it. And so far, Delta, of the variants of concern, has by far been the most transmissible, and it is by far the one that we're seeing the most of. And we're hearing a little bit about Lambda, but so far that hasn't really taken off, although it's been around for several months. And invariably, there will be new variants, which the only way to not have new variants develop is to stop transmission. And the way forward to stop transmission is to get as many people vaccinated as possible, because social distancing and masks can work for a short term, but we have to get back to essential activities. We have to get back to doing the things we want to do. And the good news is we can do both.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and Professor of Medicine at the Division of Infectious Diseases at the University of Michigan. Dr. Malani, as you say, it's important for us to continue to try to get back to some semblance of normalcy and to take precautions while we deal with this. We're also seeing the vaccination rate continue to be not staggering, but kind of hitting a standstill. It's trickling along, but it's still very slow, and it's not quite going at the rate that we would really be hoping for it to go. So as we continue to go through time and slowly but surely get more people vaccinated, but still deal with these variants, how much more important then does it become for us to take these precautions that we took earlier on in the pandemic out of an abundance of caution because we didn't have a protection like a vaccine, versus now where we have that protection, but we're still dealing with higher transmission rates?
Yeah, so there's a lot to unpack in your question, and it's a thoughtful question. One thing I will say is, as the pandemic changes, our approach has to change. And this is frustrating for people because we were doing something very different in late May and early June, and in fact, up till mid-July, we felt like I'm vaccinated, so I'm safe. But the truth is the Delta variant has changed. It's shifted things a bit. And at this time, as we are learning more about breakthrough infections among vaccinated people, the best thing to do is to sort of try and pause some of that transmission. And, it doesn't mean that you have to stay home and never leave and that you can't do anything fun. It means that you have to be thoughtful about what you do, especially if you have people in your household who are higher risk. They're either vulnerable from their own health issues or younger kids who are not yet vaccinated. And so the masking indoors is something that we can do, that we can all do. And it's something, I'll be honest, back in June and July, I wasn't wearing a mask when I was going grocery shopping. But as new information has come out, I've gone back to doing that. And it's not a real big inconvenience to me. And it helps me do my part to keep everyone around me safe. I am hopeful that we will get through this wave of Delta and that we will get people who have been hesitant or they've been waiting, and for that matter, younger kids who still aren't vaccinated at high levels, that as we get more and more moving into that vaccinated and protected category, we will get through this. And what has become very clear, even though there's a lot of unknowns, is the only way forward to something that feels more like normal for a long term is vaccination, and vaccination at a higher rate than what we had thought initially.
Yeah, and initially, to talk about that, we heard a lot earlier on in the pandemic, and really just a few months ago, and just before the UK variant became the dominant strain here in the US, that 70% threshold, 70% fully vaccinated, was right around that point where we would be declaring, or at least the CDC and the president and those in positions of power to make those declarations would say that we were at herd immunity, so to speak. With the Delta variant, with other variants that continue to rise and continue to be more powerful than the ones before them, and to have the greater ability to be transmitted and a greater ability to cause hospitalizations and severe symptoms, does that push that threshold of herd immunity back further and make that goal of where we need to get that benchmark, or those benchmarks we need to hit for vaccination rates, that much more substantial?
Yes, in a word, yes. And again, these estimates of herd immunity are based on sort of the best information you have and lots of complex calculations. But the reality is like what's actually happening. And, I will say I'm very optimistic about where we're going. And I'm optimistic about where Michigan is going. And we are doing better than majority of the country. Yes, we are seeing upticks in cases. And as kids get back to school and as the weather eventually changes, we worry about risk. And again, the best way to deal with that is vaccination. But some of the estimates that I have seen from people that I respect are 85% range. And again, that's a big jump. And our state overall, depends on where you live. It's not even everywhere. And Oakland County and Washtenaw County, where I am, happen to be the two biggest and best vaccinated counties. There are some counties that are also in that range, but they are smaller counties, particularly in the northern part of the state. But what we need to do is, again, people are talking about, I'm getting a lot of texts from friends and families like, should I go get a third dose? And, my response is, I'm not getting a third dose yet. And as I get information and as it changes, I will certainly do that if that's a recommendation. But it's more important that we get first doses in people who have remained hesitant and try to get at those issues instead of just sort of the same old thing, but trying to understand what it is that their concerns are or why they haven't gotten vaccinated yet. And, I would say to anyone who's listening who is still not certain, I recognize that for me and my family, this was an easy decision, but I do approach it with a lot of humility, and I understand it's not easy for everyone, and people have safety concerns among other issues. And, I would just ask that you have a good conversation with someone you trust and get the information from a trusted source, because we're not powerless against this virus.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and is a Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. So I want to go and talk more specifically about an issue that kind of stems from the current transmission of COVID-19, the Delta variant, and our situation here in the state of Michigan and locally. And that's the debate that's been ongoing about whether or not we should be requiring children and teachers and faculty in our schools to be masked up despite whether or not they are vaccinated against COVID-19 or not. At this moment in time, what would your suggestion be? The governor has said that she's not going to mandate that. There have been different recommendations from different organizations and different experts at different levels about what should and should not be done at this time. What would you say is the best practice for our schools here in the state of Michigan to protect not only the students especially, but also their staff, their faculty, and visitors in the community?
Yeah, so, from a public health standpoint, it's a pretty easy discussion. As to how you get there, I think that's a more complicated discussion, and I'm going to leave that to folks who develop policy to figure out how you get there. But I will say in the K through 12 space, and for that matter, the higher education space right now at this moment, and again, it looked different a month ago, even a few weeks ago. At this moment, when you have so many people that are unvaccinated, including children, this is a situation where masks need to be used indoors. And, I will just say it's not about, masks are not ideal. I get that. And I'm a parent of two children. They're older and they're vaccinated, young adults. But it is essential that kids get back to school in a face-to-face manner. It's also essential, not just academically, but economically, that we continue to move forward and get back to what I call essential activities. And going to school is not something that is an elective thing. This is an absolute must. And at this moment, given the epidemiology of what's happening, for a school to not have masks means, to me, there's going to be a lot of disruption. And there may be some communities where there's very, very little spread in COVID. And over time, you probably can drop the masks. And just because you start in September with masks doesn't mean that needs to continue forever. But, I would ask communities to look carefully at that and look at the data, because public health isn't just about you individually, it's about everyone around you. As to how we get there as a state, that's a harder discussion. And I don't have an answer to that.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and the Professor of Medicine at the University of Michigan's Division of Infectious Diseases with us today on the Megacast. And Dr. Malani, I want to go back to July until late June as we had a much different situation with COVID-19. Things were looking a lot sunnier for our future in dealing with COVID-19 at that time. Michigan was, by and large, not in a position where they had high, even moderate transmission rates, according to the CDC, of COVID-19, and we started to more aggressively reopen different sectors of the state and lift mandates and regulations that were previously in place to prevent the spread of COVID-19. And at that point, we were hovering around just over 50% and around in the mid 60% of people being vaccinated just with the first dose of those two-dose vaccines. And then by July 1st, those regulations were, by and large, no longer in place and were fully lifted. My question for you, because of where we're at now, because the variants that are out there, not just Delta but others that are developing, and because transmission of the virus continued to happen, do you believe that we began to reopen too early, or that we reopened too aggressively and should have taken a slower approach to prevent the spread of COVID?
You know, it's very easy to look back and say this wasn't done right or that wasn't done right. I feel that the opening was done based on the data that we're seeing. This is something that at some point you have to move forward with this. And, I will just say that for the last 18 months, some of us have been waiting for this magic moment where COVID's going to go away and that we won't have to think about it. And unfortunately, this is something that we're going to continue to have to think about likely for the next few years, maybe even beyond. And if you look at Iceland, for example, which is probably the most vaccinated place on earth, they have Delta variant of COVID circulating, but they don't have people getting sick. And that is sort of the point of this, is that if we can get to where people are vaccinated and people who are vulnerable are sort of protected, those around them are vaccinated, then we can get back to all these things. And these are important, not just for our well-being and that we want to meet with friends, and that is important, but also for our economy, our state's economy, our local economy. And I really hope we can look at public health alongside with the economic needs, because they go hand in hand, and vaccination gets us back to that. So, back in May and June, there really wasn't a lot of virus circulating. And I think, in fact, some people who are nervous about vaccination use that as a reason to not get vaccinated. And Tyler, we've seen those numbers, those first dose numbers. I look at them every day. I think we're hovering around 65% at this point that have had at least one dose in our state of those eligible. I think that that's correct. And so I'm hopeful that people will get their next dose. And if there's a booster, that they'll get those and that they'll tell their friends to get vaccinated, because that is our way forward. Because unfortunately, we have to learn to adapt and live alongside this virus. But we can do that while protecting public health and still doing all these things.
I do want to touch on the boosters, though, Dr. Malani. So we have one booster currently that's going to be available for Pfizer, and it's being suggested right now that it should first be available for those that have immunocompromisations that would make them more susceptible to severe cases of COVID-19 or to severe outcomes, at least, from being infected with COVID-19. Why boosters, and why that 8-month gap between that second shot of one of those two-dose vaccines and getting a booster?
So I think there are two things, and they're related. One is this idea of a third dose in individuals who fall under this umbrella of being immunocompromised. And it's a very specific list. It's on the CDC website. It's people who've had an organ transplant. They're getting therapy for certain cancers. They are on high dose immunosuppression, perhaps have HIV. There's a list. And those individuals at this point, it's recommended that they get a third dose. And most of them have had either Pfizer or Moderna, an mRNA vaccine, and they can go and get that third dose. And people are doing that now. And that third dose is to help get them immune, because there's a concern that many of them, even after 2 doses, didn't really mount a full response. And what we have learned since then, based on a really good study in people who've had organ transplants, is that third dose helps create antibodies that are protective in another half of those people. So that's the reason for that. The separate dose is this idea of waning protection. And for someone like myself and other healthcare workers, I was vaccinated in December and January, so I'm approaching that 8-month mark. And it's likely that in the next few weeks, maybe even few days, we'll get some more guidance on that and what that's going to look like. And the question is that third dose going to be a yearly booster, or will it be one time? And as frustrating as it is, we don't know. And part of this is that we're sort of building the road as we're driving, and we have to continue to be flexible, continue to be nice to each other, and continue to listen to the science and understand when it maybe isn't perfect. So people are asking me, should they go and get a third dose? If you don't fall under those categories, my recommendation right now is to just hold tight for a few days, a week or two, and we'll get more information.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. And just a few more minutes with you, Dr. Malani, because I know we're over time with you today. But for those that still are apprehensive about the vaccine, and maybe they've had some conversations with medical professionals, with their primary care doctor, maybe they've done some research from reputable resources like the CDC and the Health and Human Services Department here in Michigan, the Oakland County Health Division, and so on and so forth, but they still aren't quite sure if this is something that they want to be doing. With where we're at right now, with the Delta variant, with continued variation of COVID-19 as it continues to spread, how much more important now is it for people to get vaccinated than, or how much more, maybe better yet, it's better to say, how much more urgent is it to get people through the vaccination process now than maybe it was a few months ago when we had lower transmission and there wasn't such rampant spread in many places of COVID-19?
So Tyler, thanks for the question. I would say that it is urgent now. And I would go so far as to say you can either get vaccinated or you're very likely going to get infected. And we don't want anyone to get infected, even if, hopefully people don't get very sick, they don't get hospitalized, maybe they feel like they're young and healthy. They will miss work, and they may have difficulty taking care of children or loved ones, and they may infect someone that they love who is more vulnerable. And so I want to emphasize that vaccination is not just a way to protect yourself, it's a way to protect everyone around you. And that gets lost in this discussion sometimes, but vaccination is actually more about protecting those around you. Now, as to concerns for safety, I will just say there have now been billions of doses given, hundreds of millions of doses in the United States. And as you know, the FDA gave a official full approval to the Pfizer vaccine yesterday, and the Moderna will be coming. And I will just say the scrutiny that went into that approval is incredible. I mean, it's hundreds of thousands of pages of data. And, there have been a few cases of severe side effects, but these have been very rare, on the order of, 1 per 100,000, a couple per million. And again, it's very hard for us to sometimes judge risk, because when you talk about that risk versus the risk of getting COVID and having a poor outcome, there's no question which one is higher risk.
We're joined by Dr. Preeti Malani. She is the Chief Health Officer and a Professor of Medicine at the University of Michigan's Division of Infectious Diseases with us today. And Dr. Malani, what happens if our vaccination rate continues to kind of be at a lull as it is, and we keep having the spread of COVID-19 through variants like Delta and Gamma and Lambda and so on and so forth? How much more of a problem does COVID-19 become at that point if we don't get ahead of these variants by way of vaccine?
So I would just say at a very human level, it means lives, and it means lives lost. It means people who become sick and end up in the hospital. That's a huge cost to the healthcare system, but it's a huge cost to families. It's a huge cost economically. Some people don't get better for a long time. They have these long COVID symptoms. So that is the risk if we don't get the vaccination rate to a certain level. And it also means for children who are not eligible for vaccination that if enough of them get infected, we're going to see kids sick, and no one wants to see that. And of course, over time, it means that new variants can develop. Fortunately, the transmission in Michigan is not out of control high, but it could very quickly go that direction because things can change quickly. And, some people feel like, well, I had COVID, so I'm protected. What is really clear is that getting infection may not give you a prolonged protection, but having a previous infection and getting vaccinated is actually a very strong protection. So the recommendation is to please go and get vaccinated if you haven't done so already.
We're joined by Dr. Preeti Malani, Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. Dr. Malani, before we let you go, anything else that would be important for our audience to know at this time or to consider regarding COVID-19, vaccination, mask wearing, or anything else?
Just to say that I think it remains really difficult time. People are frustrated. It's been a year and a half of this. I never thought that we would be having this conversation that we're having right now, if you think back to March 2020. But, I'm very optimistic about where we're headed. It's just that it's going to be a little bumpy before we get to that next phase of the pandemic. But what is really clear is that vaccination is going to get us there. And, think about getting vaccinated, not just as a way to protect you, but to protect your family.
Well, Dr. Malani, we appreciate having you on, especially staying a bit longer than we had initially projected or intended with you. We appreciate your time and your expertise. Thanks for being with us today.
Thank you.
Appreciate it. Dr. Preeti Malani, Chief Health Officer and Professor of Medicine at the University of Michigan's Division of Infectious Diseases. And it's important to have these kinds of conversations with medical professionals in your community, with your primary care doctor, people that you trust, people that you know are on the front lines here and are researching this and are gathering that information and have that perspective from a medical standpoint, from an epidemiological standpoint, so that you can make informed decisions about vaccinations, about wearing masks, about your day-to-day life as we continue through this pandemic. And so we really appreciate having Dr. Malani on and other medical experts to talk more about this and to answer some of your questions, because we can have all the information we need to have on vaccines, on mask wearing, on where we're at with COVID-19 and these variants. And ultimately, you need to have that information to make the best decisions possible that you can make for yourself and for your family and for everyone else around you. So that if you do decide masks, that vaccines aren't right for you, that you can be informed and know that the best route to go is to then wear a mask to prevent yourself and others in your family from getting COVID-19, especially these more higher transmissible and variants that have greater symptoms. And so that you can also prevent the spread of COVID-19 to others as well, and make the best decision for yourself, your family, and for your community, because this is a community issue. This is a worldwide issue that we all have to solve together. And there will be a time for us to evaluate what we've done during this, but we can Monday morning quarterback decisions all we want. The fact of the matter is we're still dealing with COVID-19, and we still need to solve this issue collectively and then make our individual qualms and arguments with each other. We can do that later on when we solve this, because like Dr. Malani said, this isn't just numbers, this is lives, and lives are important, and we need the help to prevent the spread of COVID-19 so we can save lives of people in our communities, in our neighboring communities, in our state, our region, our country, and all throughout the world. We're going to take a quick break. On the other side of the break, we'll review a little bit more of our resources and where you can find some more information on COVID-19, as well as more information on ourselves here at the Megacast and our partnering stations. That coming up. You're watching and listening to the Oakland County Megacast.
A message from the staff of Michigan's Crime Victim Compensation Program.
Anyone can be a victim of crime
and suffer lasting trauma, physically, emotionally, and financially.
But you are not alone.
If you're struggling financially due to a crime,
we're here
for you. Find out if you qualify for crime victim compensation. Call 877-251-7373 or visit michigan.gov/crime-victim.
A message from the Michigan Department of Health and Human Services, Division of Victim Services.
You see certain things get reincarnated in your children. My daughter is very much inspired by my wife's artistic pursuits. So my daughter started making necklaces. She makes what we call affirmation fashion. I tell her every day that your black is beautiful. Your black is beautiful. Your black is beautiful. And if there's anything better than being beautiful, it's being smart. And if there's anything better than being smart, it's being kind. And reaffirming that every day is our method of making sure her chin never drops. My dad wasn't around, and I remember riding a bike and falling off and cutting myself, and me never just wanted to get back on it. People ask, how your children learn how to ride a bike, and you didn't. I didn't teach them. I just created an environment where they taught themselves, and all I had to do was be there.
Welcome back to the Megacast. I'm Tyler Keefe in our studios here in West Bloomfield Township at Green Media Center on Walnut Lake Road on the campus of Chico Elementary School in the West Bloomfield School District, where we broadcast each and every day live 10 a.m. to 12 noon here on the Megacast, bringing you the latest information, of course, about COVID-19, as this show was born out of the COVID-19 pandemic, but also on other important news and information that affects us here in Oakland County, in southeastern Michigan, in the Lower Peninsula, and all across the Great Lakes State. And we're on a number of different community outlets. We have partnered with stations all throughout southeastern Michigan and really across Michigan to broadcast this show, to make sure that we get this information to as many people as possible, not only about what affects Oakland County, but what affects our neighboring counties and our entire state. Because like I said before the break, this is a community issue. This is a collective issue. And it starts with us, of course, individually. We have to make the smart decisions and thoughtful decisions that then impact others down the line. But it is ultimately a community issue, and it's a statewide issue, a countrywide issue, and a worldwide issue. COVID-19 is, and we solve issues like this by coming together. So you can find more information on our partnering stations. Of course, we're here on Civic Center TV on Comcast Channel 15 and AT&T Channel 99 in West Bloomfield, Keagle Harbor, Orchard Lake, and Sylvan Lake, or Greater West Bloomfield as it's called. We're also on Birmingham Area Municipal Access, which is a service of the Birmingham Area Cable Board. That's in the Birmingham Bloomfield area. Also Comcast Channel 15 and on AT&T Channel 99 in those specific areas. You can watch us online, Civic Center TV, 24 hours a day, 7 days a week on our 100% 24/7 live broadcast stream, civiccentertv.com. Click on our Watch Live link right there and view us 24 hours a day, 7 days a week, whether it's the Megacast or any of our other regular programming. You can listen to us live 10 a.m. to 12 noon on the radio on 89.3 Lakes FM. That's also where you'll find our replays daily, 1 p.m., 5 p.m., and 8 p.m. during the week, where we rebroadcast our show each and every day. We're also on 88.1 WBFH, The Biff, which is the service of the Bloomfield Hills School District, and outside of our regular programming here, 10 a.m. to 12 noon with them. You can find great programming from high school students and other students in the Bloomfield Hills School District all throughout the afternoons regularly during their school year. And trust me, they do good stuff. I can attest to that. Maybe not in my own case, when I was a student there from 2009 to 2013, during that 4-year period that I was on their high school radio staff. But they have really talented people there. I've listened to a couple of their sports talk radio shows and their variety programming and their music DJs. They are pretty impressive. So definitely you want to take a chance to tune in to some of their regular programming throughout the afternoons when they have their students doing great live broadcasts and learning the tricks of the trade. They're the future of our broadcasting, not only television, but also on the radio as well. And you can find us on our Facebook page, facebook.com/civiccentertv15 or civiccentertv.com, and we have a Facebook icon right there on our homepage, takes you directly to our page. Same thing with Lakes FM, facebook.com/Lakes FM. We have a coronavirus page as well on our website at civiccentertv.com that brings you resources from the Centers for Disease Control, the state of Michigan, and Oakland County, as well as many of our local municipalities here in southeastern Michigan, specifically about COVID-19. You don't need to go digging around trying to find information that may or may not be reliable from all sorts of resources out there on the internet. The internet is a mess. We try to clean up the mess a little bit for you and find information that's directly from these sources. It takes you right to those pages. You can read the studies. You can get questions answered from their FAQs, from their experts, and you can find more information about vaccines, about the effectiveness of mask wearing, about where we're at with COVID-19, all from one spot. Your one-stop shop for COVID-19 information from reliable sources is civiccentertv.com/coronavirus. And before I stop on this, I want to talk about one more of our partnering stations, partnering outlets, and that is My Michigan TV. It's a brand new streaming network service that provides free Michigan content from all across our state. Not only the Megacast live Monday through Friday from 10 a.m. to 12 noon on My Michigan TV or My, but they also have other great programming. We have an automobile expert, Steve Lato, who does a live show Monday through Friday from noon to 1 live on My. And not only can you view that on your smart TV, on Roku TV, Android TV, Fire TV, Apple TV, others, whatever you get your smart TV services from. You can also get it right here on your mobile phone, a free app in the Apple iStore, in the Android App Store as well. My TV, it's My Michigan TV, MYMITV.com, MYMITV.com, or you can find content from all across the state of Michigan, whether it be news, whether it be documentary style, whether it be some sort of a talk show like this or like Steve Leto Live. That's all on My Michigan TV, MYMITV.com. And of course, you can always find great regular programming on our website from the Megacast on civiccentertv.com/Megacast. Find our full interviews and find full episodes and our individual interviews as well. So if you're tuning in today and we really wanted to hear just what we had to talk about with Dr. Malani from the University of Michigan, that'll be on our website later on today on civiccentertv.com/Megacast. Click on those full interviews. You can listen to that interview, watch that interview with Dr. Malani, or if you want to watch the full episode, you're just joining us now, you missed the first 45 minutes of the show, the first hour of the show. That's also on our website. That'll be there later on today for your viewing pleasure at your convenience, anytime, wherever you are, on civiccentertv.com/Megacast. We're going to take a quick break. You're watching and listening to us on your radio home. You're listening to us on 89.3 WBLD Orchard Lake and 88.1 WBFH Bloomfield Hills. On the other side of the break, we'll be talking about the upcoming school year. And right now, our schools in Oakland County are still in great need of paraprofessionals to work in our school buildings. Almost every school in Oakland County is in need of these workers. And we'll be joined by Karen Olex. She is the Executive Director of Special Populations at Oakland Schools to talk about those job availabilities, what kind of goes into being a paraprofessional, what these school districts are looking for, and how you can get involved and not only have some great work opportunities, but also be very vitally helpful to our local school districts who we have definitely seen over the last year and a half plus have been working harder than ever to provide quality education to our kids here in Oakland County. So that is a really interesting interview. I'll be pleased to be joined by Karen Olex. After this break, you're watching and listening to the Megacast.
Who is struggling right now?
I am.
My son is.
Many are struggling with anxiety, depression, and substance use. Before it becomes a crisis, reach out to MyCal, the Michigan Crisis and Access Line for free confidential support 24/7. Available in the Upper Peninsula in Oakland County. Just call or text 1-844-44-MyCal or chat online at michigan.gov/MyCal. A message from the Michigan Department of Health and Human Services.
School is difficult in this day and age for any kid and for any family, but especially those families that have children with special needs. And to join us to talk about that specifically, we're pleased to be joined with the Executive Director of Oakland Schools Special Populations Department, Karen Olex, now on the Oakland County Megacast. Karen, thank you for being with us today.
You're welcome.
Karen, right now, let's just get right into it. As we prepare for this school year, with all the factors that are at play right now, what is the number one need in our schools at this moment in time for children and families with special needs?
Well, I guess it's kind of a loaded question because there's many needs, many number one needs, but the most important need today is to make sure that we have the staff available to open the schools and make sure that the students are receiving a proper education, a free and appropriate public education with the appropriate staff. And that, again, is why we sent out the media blast on the need for paraeducators.
And for those that are unfamiliar, there is also a great article on the Detroit Free Press, Michigan Schools Special Education Aid Jobs, that lists a bunch of those that are available. And there is, according to this article, it's listed as saying there is an urgent need for these. Just how much of a deficit in this department are our schools across the Oakland County area specifically? How much of a deficit are they at in these positions?
Well, so we are I did an informal survey with our local directors, and about 15 of them responded out of 28 And out of that number, it was up 16%. We're still down about 16% of the need for paraeducators. And that was a week ago. And they've been trying to hire all summer, and they'll keep on hiring right up until they have all the positions filled, but currently stands at about 16%.
And for those that are unfamiliar, what are paraprofessionals? What do they do in the classroom?
So paraprofessionals they're also called teacher assistants. They're called instructional aides. They've got many, many different names, which kind of helps with the confusion on how to apply for the job. But what they do, their jobs vary on the needs of the students. For a student with an IEP, they might be someone to reteach a lesson. They might be someone to model appropriate behavior. They might be someone that goes with them to the general ed class as an aide to help them understand directions. They help the teacher make sure the special education class is organized. It just varies on the different needs of the individual students.
In a situation pre-pandemic or during pandemic, without paraprofessionals in the classroom to help these students through these lessons, to help the teachers as well provide the necessary and proper education for all of their students regardless of circumstances, what kind of situation are we looking at potentially this fall and through this school year for students with special needs?
So without the paraeducators, it makes it a little rougher for the teacher because it puts more pressure on the teacher to make sure that those students are receiving everything that they need for their IEP. Again, a paraprofessional is not the teacher, and a paraprofessional is not typically written into an IEP because they are there to support and reteach and things like that. But without the paraprofessionals, it makes it more difficult for the teacher to get to every student needs in an in-depth way so that every student has a little bit extra support as they are going through many of the general ed curriculum needs that they have and or their behavioral needs. We also have, I forgot to mention, we also have some medical paras out there, and they're called medical paras or just paraeducators. And those are the paras that help with the students who have diabetes or maybe have a trach that needs a trach clean, things like that. So in that sense, they have to be hired because those paras are vital in the survival of the students. So again, it's a wide gamut of what they have. Without the paraeducators, it puts that much more pressure on an already overburdened special education teacher.
So on the topic of IEPs, what exactly is an IEP? Can you explain that a little bit more, and what exactly does a student need to qualify for an IEP?
So an IEP is an individualized education plan. And there are 13 areas of recognized disabilities through IDEA, which is a federal law. It started off as 94-142, then it was reauthorized in 2004. It's called IDEA 2004. And what this is a federal law that mandates students who have specific disabilities still receive a free and appropriate public education in their least restrictive environment. And the students with an IEP are considered to be general education students first. Therefore, the special education program, the individualized education plan that is a yearly meeting with parents and all the staff that will help support the student, kind of determine what kind of extra supports or what are the needs of the student in order for that student to receive the access to the general ed curriculum.
And what about, on the same topic, a 504 plan? Is that in the same category? Are those students also considered to be special needs, or is that something completely different?
So, it makes it difficult. Special needs can be I could be special needs. Anybody can be special needs. If you have a special need, you could be considered special needs. But a student with an IEP has been identified through federal guidelines as a student who's requiring specialized instruction in order to receive his free appropriate public education in the least restrictive environment. A student with a 504 is part of the Rehabilitation Act, and that assures access. So yes, there's students with special needs as well, but there's the student with a 504 is more of a need of having access to a building. With the students. So there's a little bit of a different, they're not necessarily requiring specialized instruction as much as supports so that they are able to gain access.
Karen Olex joins us now on the Oakland County Megacast. She is the Executive Director of Oakland Schools Special Populations as schools throughout Oakland County prepare for the 2021-2022 school year with COVID-19 very much still in mind, and with a great need for paraprofessionals in the classroom. And Karen, among the jobs that are available for paraprofessionals in our schools in Oakland County, are these full-time jobs? Are these part-time jobs? Does it vary?
No, yeah, they could be a part-time job, but in all honesty, for most of them, they are full-time positions. They are in the school during the school day. They have time off when the teachers have time off or when the schools are closed, obviously. And they are work side by side with the teacher as part of the building. They become part of the culture in any given building that they're at.
And what are some of the qualifications for these jobs?
So again, depending on the position, but typically all you need is a high school diploma and a loving, caring demeanor with children.
In an ideal world, if these schools could wave a magic wand and put the perfect candidate for these paraprofessional jobs in their classroom, what would be some of those qualifications or backgrounds that these professionals would have when they're entering the classrooms?
Well, again, I think it's a true, honest, caring demeanor for children. I think that it would be somebody who could follow directions, somebody who has the ability to take some initiative, somebody who has the skill level to work collaboratively with their teacher of record for special education, as well as the general ed teacher environment, someone to be able to assimilate into the whole school culture. And somebody who will be able to understand a child's disability. Whether the child is a learning disabled child or an emotionally impaired child or on the autism spectrum, understand the nuances, the minor nuances of those, and be able to adjust their interaction with the child to meet that child's needs.
So these jobs are available. Are there a lot of these available across Oakland County? Are there select school districts? What is the status of this availability?
So as far as I'm aware, every single district still has openings for paraeducators in Oakland County. And they are looking to do whatever they can to help these paraeducators come and work for them. Some of the out-of-the-box thinking that the directors of special education have worked with their local districts to provide is maybe a finder's fee. If you work already at a local district and you bring in a friend and they become a parapro again, there might be a little bit of a finder's fee for you, they're calling it, or perhaps a stipend, or if you stay the whole year and stay as a parapro for the whole year, at the end of the year, you might get a little bit of money. And we're not talking big money. Remember, this is public education. So we're talking something to sweeten the pot a little bit to keep them together, where some of the districts are allowing friends to work together in the same district, in the same building, so that, the camaraderie is already built there. A lot of the districts have tried to raise the salaries of the paraeducators. Traditionally, over the years, there were very few, maybe one in Oakland County district who was able to provide healthcare benefits to paraeducators. They're trying to figure out how to be able to afford healthcare benefits to offer those to paraeducators. They're really thinking out of the box and trying to find some money somewhere to help encourage people to take these positions.
Now let's talk a little bit about that encouragement and those proverbial carrots that are being dangled, because right now there are a lot of people that are leaving the education field or have been throughout this pandemic, and there seems to be some hesitation to get into that. Not to mention, we have such a competitive job market across a number of fields. So in terms of incentives for prospective employees to take these paraprofessional jobs, what is available in Oakland County, or what is being offered?
Well, again, just what I just threw, those are the kind of the incentives that are out there. Again, there are so many needs for these paraeducators, making a difference in your community, helping work closely with the teacher, have a caring heart. As for the carrots, I mean, their hands are pretty limited when it comes to salary and benefits and things like that. They're trying to work through their Board of Ed along with their superintendents to make sure that they can provide everything they can to help people see that these are not only much needed and much rewarding positions, helping students, very, very rewarding in your community, but worthwhile.
Karen Olex with us on the Oakland County Megacast, the Executive Director for Oakland Schools Special Populations, joining us on today's edition of the show. If you missed any of this interview and you want to watch more of it later on or watch the entire thing on demand later on, it'll be on our website, civiccentertv.com. Just click on our Megacast link and you'll be able to find it all right there. So Karen, as we have as we are preparing for the school district and for the school year, as we're preparing to send our kids back into the classroom, some in situations that will be in person, some in situations that may be hybrid, what advice does your department have right now for parents and for educators, frankly, as we're preparing for this school year? Because these changes have impacts on all students, especially those with special needs.
Well, I think the main thing people can do is to remember that everybody's in this together, that we are trying to provide an education for students in a world situation that we have never experienced before. So I think the advice I would give is to please stay together, please communicate with each other, please collaborate with each other. The better everybody gets along, for lack of a better way to put that, the better it is for students, and their education will thrive as a result of that.
We've heard a lot over the course of the pandemic about the buzzword learning loss, or the buzz term learning loss, as there's been those shifts from in-person to hybrid, or from hybrid to entirely online. In terms of our special needs student populations, what impact has the conditions of the pandemic had on their learning and their potential for learning loss during this time?
Well, I think the pandemic, it hasn't caused any more learning loss for special education students as it has for general education students. And again, educators are trying to figure all that out. This is not something that, again, we had schooling on. You didn't have pandemic 101 when you went to school. So it's something we're all trying to work and figure out together. And I think that, again, we're not normal yet. We're not back at a normal school year yet. So how do you figure out learning loss when we're not back yet on what has been done in the past? So it's just all moving forward as to who knows what and who's done what and how students have survived. Some students did really, really well with online schooling, some students not so much. So again, everybody's trying to think outside the box and do whatever they can so that each student receives the education they deserve.
Circling back to the issue of paraprofessional job openings that are so en masse right now in the Oakland County area, as you said earlier on in this interview, there are openings in pretty much every school district here in Oakland County for these jobs. Why is there such a shortage of paraprofessionals specifically in our schools here in Oakland County?
Well, I think there's a shortage everywhere across the state, from what I understand from my colleagues and other ISDs. However, I think that it is a multifaceted problem. There is the fact that it's hard work. It's hard making sure that students receive everything they need. Students have some severe issues that require some support from the paraeducators. I think COVID is another factor that comes into that. You're going into a school, you're going into a building. COVID is part of that. The COVID pandemic, we don't know where it is or how it's happening, or the Delta part of COVID and all of that. I think that there are higher paying jobs elsewhere that require a high school diploma. I think that that's a factor. I think the unemployment as a result of COVID, the increase of unemployment is a factor of that. And I think that there have been some people that have pretty much left the metro area in the past years. So I think that's all factors, some of the factors that all weigh into that, just education as a whole.
We're really getting down to the wire. It's just a couple of weeks now until many of our schools will begin their school year ahead of Labor Day, which has been uncharacteristic in several years past. So as we're approaching that date, how much more of a concern does it become for these school districts as we get closer to those dates to not only get these professionals in the door as goal A, but goal B, almost more importantly, to get them prepared for their specific students in this specific school year?
Well, I think that's, as every day that goes on, every day that passes by, it becomes more, and you have a greater sense of urgency. You know you need the staff. You know you need to prepare the staff. You know that the staff needs the training. And a lot of the districts, you're right, they're opening before Labor Day, so they're having their staff professional learning opportunities in the next couple weeks. So directors are trying everything they can to get everybody in place.
Just another couple minutes with you here on the Oakland County Megacast. We're joined by Karen Olex, the Executive Director of Oakland Schools Special Populations, with us on the program. And as we are approaching that date, if people are looking for jobs and are interested in serving in our public schools, a need that is so great right now, and particularly in these paraprofessional positions, where can they find more information and maybe even apply for these jobs?
Yeah, that would be great. If they could go to the Oakland Schools Hiring Consortium website, and it's right, if you go to Oakland Schools, our Oakland Schools Internet Access, it'll take you right to the area that you can apply, and you do it all online. And all the districts are part of our consortium, and you can go to each individual district. If you want to work in a specific district, it's listed right there, and you can apply right there, all online.
Karen Olex with us, the Executive Director of Oakland Schools Special Populations Department on the Oakland County Megacast. Just another couple minutes with you, Karen, before we'll say goodbye today. Anything else that you would like to mention today that would be important or interesting for our audience to know?
All I would like to say at the end is that what I would like to tell everybody is that this is a very rewarding job. Students can get into your heart, and you care about them, and you can make a difference in your community. And if you're looking for a job to not only give you an income, but also make a difference in your life, I would strongly suggest that you apply as a paraeducator. It is a very, very rewarding position.
Well, we appreciate your time, and we appreciate your efforts as we come into another school year with a lot of questions, a lot of uncertainty, and we appreciate you and your team at Oakland Schools and the Special Populations Department that are doing their part to try to curb some of those uncertainties. Karen, thank you very much for being with us today.
Thank you. Thank you so much. Have a great day.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. You know, being 27 and a mom and a wife, and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
Motorcyclists are hard to see. To keep everyone safer, it's important to always look for them and know where most crashes occur. 84% of motorcycle and vehicle crashes happen on streets, not highways. And most crashes with motorcyclists occur when vehicle drivers are turning left. So before turning, especially to the left, make sure you look for motorcyclists. Then look again. It could save a life.
Welcome back to the Megacast. I'm Tyler Kieft alongside studio producer Calvin Brown here in our studios in West Bloomfield Township as we continue to talk about COVID-19 and other issues and interesting projects and things that are going on in our communities all throughout Oakland County and across this great state of Michigan. Each and every day, live from 10 a.m. to 12 noon. We're pleased to be joined now by Alice Durham and Nicole Harrison, the founders of the nonprofit Kayla Marie's Hope Services, or KMHS, with us now on the Megacast. Alice, Nicole, thanks for being with us today.
Thank you for having us.
So for those that may not be familiar, and this is the first time they're hearing about your organization, tell us a little bit about Kayla Marie's Hope Services.
We are a brand new nonprofit agency that is here to help young girls 17 to 25 that have experienced any kind of trauma. It could be homelessness, it could be domestic violence, human trafficking, substance abuse, anything that has caused them to turn to destructive powers, to try to find a way out or to try to find comfort. Our agency is going to be here to help to provide hope and unconditional love.
We're joined by Alice Durham and Nicole Harrison. They are the founders of the nonprofit Kayla Marie's Hope Services. And tell us a little bit about Kayla Marie, because she, of course, is the inspiration behind this organization. But her story is in many ways similar to a lot of other people's stories that are those people that you are then serving through this organization and helping. So tell us a little bit about Kayla Marie and how her story and her life inspired the work that you're doing.
So Kayla Marie was my only daughter. She was raised by a single parent. Her father was in prison almost her whole life. And so it was just me and my family. So Nicole's mom and Nicole and her sister were my other half. When I had to work, she would come to their house. And I did the best that I could as a single parent. I myself had long-term recovery, so she wasn't exposed to a lot of the nonsense that some kids are exposed to. However, she had some things happen to her too. Life wasn't always easy with a single mom. From 2009 till 2010, we had 4 very significant deaths in our immediate family that really impacted her, and found out later that someone had told her that she had to be strong for her mom, be a good girl and don't cause any problems. And during that time, she was sexually assaulted, and she didn't tell anyone because she was trying to be a good girl and not be in trouble for her mom. And at that point, her life just kind of spun out of control. She didn't know how to handle that assault. She ended up turning it inside out. Someone took her control, and so she decided that she wouldn't allow that to happen again. And so she became an aggressor. She started, chasing older boys and dealing with older boys, thinking that she was in charge. And along with that came drug use, suicide attempts, suicide threats. We got her involved in counseling and different treatment facilities, trying to stop it. But I think that all along, there were certain things that she enjoyed about the behavior, and then there's that whole stigma that comes with, if I enjoy bad things, then I must be a bad person. And I think that those things just kind of got the best of her. And then she was so young, she thought that she could always stop later.
We're joined by Alice Durham and Nicole. Oh, please go.
Oh, no, I was just going to say she was a shining star, the circle that didn't fit into the square, that we oftentimes try to push people into, in this society. We all have a uniqueness and she loved music, and she loved hanging out with friends, and she loved the togetherness, us as a family. We always did that kind of stuff. That was the fun for us. Times are hard, money's tough. What do? You love each other. And so that's what she was. She was love and just a sparkle, wanting to have fun and find her way. Everything just seemed so tough.
We're joined by Alice Durham and Nicole Harrison. They are the founders of the nonprofit Kayla Marie's Hope Services with us on the Oakland County Megacast. And Alice, Nicole, as you're forming this organization and beginning to plan and planning the services and doing fundraising, what are your current goals right now? What needs to be accomplished so that you can begin to provide these critical services to people that are in need, like Kayla Marie was, to be able to help them have a different journey than hers, maybe and then maybe have a happier outcome, of course, for themselves and their families and their loved ones.
Yeah, absolutely. Our biggest goal through the initial start is to obtain the 501c3 status of a federal nonprofit organization. And from there, we want to purchase our first 4-unit flat in Detroit, which was a place very, very close to Kayla's heart. She loved the activity. She loved the upbeatness. She loved how close everything was. She was a ball of energy in a body just ready to explore. And so, and in that came the experiences that didn't work out so well. So we also know that in that area, that's what's best to start. So to purchase that and then to have that space where girls who are suffering, who are in pain, who are at their ends wit, and don't feel like they have any hope for anything else. It needs to be available so we can help them understand their value, help them understand what they're missing to love themselves, and to provide services and resources that will help them meet them where they are, to be able to be successful on their journey.
In terms of that goal, having this housing that can have these girls be brought in and have that environment there and that support system, how critical is that to helping them through those struggles similar to what Kayla Marie was having, or other struggles that may be had in life for these women? How important is having that support system, that in-house support system that's there, that's got other people that are maybe going through similar situations or have been through similar situations to help them through those moments?
It's huge because girls that age are very influential, and a lot of times if they don't have anywhere to turn, they do what they know best. They use their bodies. They trade their bodies, they sell their bodies, they do whatever's necessary to have a roof over their head, to have somewhere to go. And so if they have someplace to go where they don't have to do that, and they can be around other girls that have had those experiences and either have found the way out through our help and our services, the home would be a transitional home. So we would help them to be able to get off the streets if they're in a domestic situation, whether it's at home with their parents or maybe they have a brother or a cousin that's abusing them, or if it's a domestic situation with a boyfriend, it will give them a safe place to go. And then the goal would be eventually to have long-term transitional services where maybe we could help set them up with an apartment, be able to follow them for quite a while and always offer support. They would be able to come back and give back to the newer girls.
Our emotional balance is huge, and our experiences are full of so many emotions and feelings and a lot of things that most of the time we don't fully understand. And we're not going to always get the answers outside. So the environment we're in is crucial to support and build and uplift us in the most positive way, because we truly believe that if love could have saved Kayla, that it would have, that if she would have just believed in herself and loved herself enough to make better choices, that she wouldn't have made the choices that led her to not being here today.
We're joined by Alice Durham and Nicole Harrison. They are the founders of Kayla Marie's Hope Services, joining us on the Megacast today. And as you are going forward and planning to provide these services, what, on top of the, of course, 501c3 declaration and all of that you need to be a federally recognized nonprofit, what else are the most immediate needs for you to be able to provide these services to people right now?
The most immediate need would be the house, or the property where we could build a house.
We're open.
Yeah, we're open to whatever anybody is willing to propose or donate or partnership with. We know that it takes a village, and so we are trying to stay open to any possibilities. We don't want to put a limit on anything. Whether it's someone that wants to donate services, or if they want to donate supplies and only be paid for, or vice versa, be paid for their supplies and not for their the labor. We're just trying to stay open to whatever the universe sends us.
So yeah, the location within Detroit, excuse me, close to, I'm not familiar with the area, forgive me, is East Side?
Either
West
East Side
Side
or West Side. She started off on the East Side and then she ended on the West Side.
And so whether it's property to build or a house that's there that we can fix up, we need that place for people to be able to know within their mind and have that vision that they can say, oh, that place is here within the world to be able to go. And that is really where we have to start. And from there, we can fill that place with all of the services and the wonderful people and volunteers or individuals who may come by to help inspire this dream to be even bigger, because it's not just our stories that matter. Everyone struggles, everyone goes through things, and we're all one, really, and we're in a lot of pain right now. So having more to count on within one another is huge.
We're joined by Alice Durham and Nicole Harrison. They are the co-founders of Kayla Marie's Hope Services, or KMHS, joining us today on the Megacast. And Alice and Nicole, for those that would maybe know somebody that could really use these services, or somebody that is watching or listening that knows that they themselves could really use these services, as this organization begins to grow and continues toward that ultimate goal of being able to provide this housing, provide these services, how would people seek your support? Would that be something that, of course, individuals could seek, but also families could seek on behalf of individuals also, and try to encourage those loved ones to seek this help themselves, or have you help them seek that help?
Sure. Because we're in the very early stages, I'm not sure what we could do other than to be a resource, and resources are huge. So anybody is able to reach out to us now. Our email address is kmhopeservices@gmail.com. And, if you send us the information and let us know what you're looking for, we can definitely help you to find services. Our goal is to be able to do joint ventures with other agencies. We had a fundraiser this weekend, and we had Judson Center, who is one of the mental health services service providers in, I believe, in multiple counties, Wayne, Macomb. They were there providing information. We had Detroit Recovery Project outreach team there providing information. We were co-sponsored by Share Incorporated, which is Self-Help Addiction Recovery Incorporated, one of the largest treatment facilities in the Detroit area. So, we are definitely building our Rolodex of services and places that can offer help, and, so that we can do referrals to and from those places.
And as far as we as individuals go, I know that since losing Kayla, I have been inspired in many ways to just seek different skills for self-healing. I'm a certified life coach, and our email is there, even if you just need to reach out, if you just need to, say, hey, can I talk? Or, hey, do you have any suggestions for this? Or what have you? We're here. And this is how it starts. And we, as in the two of us, plus whoever joins us, is only going to get greater. So please, if you're struggling right now, it's meant to be that you reach out to us, and we will just be there to help guide you the best that we can.
So if people want to find more information about how they can help you, about where the organization needs to go to be able to provide these services, or to provide donations, whether it be physical donations or it be monetary donations, whatever the case may be, what's the best way for them to get in contact with you and to learn more?
The best way would be through the email address. We do have Cash App and Venmo. Both of the password, or not passwords, both of the logins are the same. It's for Cash App, it's $, and for Venmo it's @ and then it's Kayla Marie's Hope for monetary donations. Or you can go to you can send us the email address, and we can send you the physical address to send checks or money orders. But as far as offering services, offering building services, or we had an agency reach out to us that wants to help us to get our 501c3. So anything like that you have in mind, please feel free to reach out to us through the email. We will be working on a website shortly as our means become available. So if you're someone that does websites and you want to help us, feel free to reach out. This was a thought, it was a desire in our minds, and something just hit us. Let's do our first fundraiser. And so what started as an idea turned into this huge thing. It felt like overnight. And from there, we just, started reaching out to as many people, as many places as we could in order to get sponsors and to get donors. And it just exploded. And we are very pleased with the first fundraiser that we had on Sunday. And as a result of, the news coverage from Fox 2, people have just started reaching out to us and offering help. So we're extremely grateful. Thank you so much.
We appreciate having both of you on. Thank you.
Thank you.
Again, we have been joined by Alice Durham and Nicole Harrison, the co-founders of Kayla Marie's Hope Services. Learn more information and find out how you can help them by sending an email to kmhopeservices@gmail.com. That is kmhopeservices@gmail.com. We're going to take a quick break. On the other side of the break, with about 20 minutes left on our show today, we're going to be talking to another couple of people, Mike and Robin Kinnie from Audio Engineers Detroit, as you, of course, tune in every day to those smooth sounds of Lakes FM and the Biff on the Megacast here. They're also providing some smooth sounds from their new studio. They are from Audio Engineers of Detroit. We'll talk to them more about their recording studio and their projects here in the local area. On the other side of the break, you're watching and listening to the Megacast.
To Sophia and Gabriel, even though these old knees can't follow on your adventure to the forest today, these flowers represent my love. These stitches and threads join us together. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you.
Make the forest part of your story at a park near you. Find one at discovertheforest.org.
Can I ask you a question? Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
I want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know.
The boys lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
Welcome back to the Megacast. I'm Tyler Keefe, alongside studio producer Calvin Brown. You're on the Megacast in our studios in West Bloomfield Township. We broadcast live each and every day, Monday through Friday, from 10 a.m. to 12 noon. On the Megacast on Civic Center TV on 89.3 Lakes FM, 88.1 WBFH, the Biff, as well as on My Michigan TV or My. You can find more information on Michigan's streaming network, My Michigan TV, at mymitv.com. That is mymitv.com to learn more about My and learn more about all of our partnering stations and everything that we do here at the Megacast at civiccentertv.com/Megacast. And part of what we do is, of course, a radio broadcast, and that requires crisp, clean audio every day. Calvin's over here working hard to make sure we're sounding good. We're looking good over here. We have other people all throughout our community that are doing the same thing for recording artists, for podcasters, and for people that just want to learn about producing quality audio production all throughout our local area. And we're pleased to be joined by the owners of Audio Engineers Detroit. Mike and Robin Kinnie join us now on the Megacast. Mike, Robin, thanks for being with us today.
Thank you for having us.
Thank you.
So tell us a little bit about yourselves and your background that led you to develop Audio Engineers Detroit.
Well, it really started with Mike's dream. This is a 20-year dream in the making that's finally coming to fruition. So he has a vast range of experience working in audio. And over the years, he would get a lot of questions from people asking, well, how did you get into this industry? Where do you go? And so he started putting this plan together actually 20 years ago. And it wasn't until we got married and, I learned of his dream that we were able to start taking those initial steps of actually opening our own recording studio.
We're joined by Mike and Robin Kinnie on the Megacast. They are the owners of Audio Engineers of Detroit. So Mike, tell us a little bit about Audio Engineers of Detroit and some of the services that you provide for content creators and podcasters and other people that just want to learn about quality audio production.
Well, Audio Engineers of Detroit is a full access recording studio. We offer, recording, mixing, podcasting. We offer classes, just a whole range of things for content creators to come down and get some studio time and be able to create. It's like Robin said, it was like 20 years in the making. We just wanted to be sure that we wanted to offer the city a recording studio, state-of-the-art recording studio where people can come and work and learn the craft if they want to.
So what kind of is the difference there? Because you have the ability for people, you want to give people the ability to learn this craft, to learn what goes into quality audio production, and be able to operate a studio that they can create audio productions, whether it be a radio play, or it be a podcast, or it be some other sound production that's needed for film or for television or for some other project. But at the same time, you're also providing a space for people to produce this content as well if they already have that expertise but don't have the equipment that's necessary to really put that into its best practice and its best work. Is that correct?
Yes. Well, our class actually, if you take our class, it actually comes with equipment that the student gets to keep. That's theirs to own. They work on that equipment all through the program. And so you can put into practice what you learn instantly. So that's one of the advantages of Audio Engineers of Detroit classes, is that it comes with like a full mini studio that you can take with you anywhere and record anywhere, anytime. So that's a big plus for the student when you're kind of learning audio, because you can learn something, but if you don't have the equipment to keep in practice, you might tend to forget it, or it just won't stick as well as you having your own equipment, being able to take it home and make beats or record a podcast and just having your own equipment to be able to do that is a plus.
We're joined by Mike and Robin Kinnie on the Megacast. They are the owners of Audio Engineers of Detroit with us today on the program. And so with that being the case, we've seen a lot of different podcast studios and recording studios like this, independent studios that are popping up over the last several years. What sets Audio Engineers of Detroit apart in the way that you operate your business and the services that you provide from these other similar organizations that are doing like work?
Well, we like to consider ourselves a teaching recording studio, not only because we offer courses, as Mike has mentioned, so someone could come there and actually learn the art of audio engineering, but we're also community-based. So we have been really intentional with creating collaborations with the Hannon Center, where we're located in Midtown, but also Detroit School of Art. We want to be part of creating the next generation of audio engineers. So what sets us apart is that we're not just a business. You don't come in, get a service, and you leave. We really are part of the community, and we have a larger focus of supporting the creative community in the area and working with everyone from youth to seniors.
We're joined by Mike and Robin Kinnie on the Megacast. They are the owners of Audio Engineers of Detroit. And so your business did open in the spring of 2021. If people are interested in these services, either in the classes, how often do the classes run?
The classes run every 9 months, because we have two classes. One is 101, and then we have 201. The 101 is like 12 weeks, and then the 201 is 24 weeks. So the total program is 9 months. So we have the program starting right now. Our first class starts in the first week of September, and we'll probably start classes, I would say, every 12 weeks.
And then in terms of the other services, the recording services, how can people sign up for that? Are there arranged times? Is there one or multiple areas that they can record in at your business? How does that work?
Well, we have one recording studio. Okay. They can always go to our website and reach us at aeddetroit.com. And they can reach out to us, give us a call. They can come and tour the studio and see it, and and we can go from there.
We're joined by Mike and Robin Kinnie on the Megacast. They are the owners of Audio Engineers of Detroit, and if they're signing up for this recording time, are there set blocks that they can record in, or is this open to whatever the needs are of the individual recorder, and it's more on a first come, first serve as available basis?
Yes, it's basically first come, first serve as available basis for people who wants to use the studio. Like I say, but you can always come down and get a tour. We will be holding seminars and different things down there also. So it's a lot of things that we have going on and planned. So we welcome anybody who wants to come down and see the studio and use the studio.
In a brief moment of playing the devil's advocate, I'm gonna ask this question because today, with all the access that people have to specialty equipment for audio engineering and production, and also to tutorials, whether it be on YouTube or on Vimeo or from some other service, why should they go to Audio Engineers of Detroit? What makes your services far and beyond better than those options that they have that are also out there for them on the internet that they can do from home?
Well, the studio that we have is state of the art. I mean, everything is state of the art. So, and that's just something that you can't learn, in your basement. We have all the state of the art equipment. We have top-notch instructors and engineers who've been in the business. All my engineers, I would say the combination years in the business is about 70 years. So, these guys have a vast wealth of knowledge and skills who can and really teach people how to take your audio recordings to the next level. YouTube and all that stuff can only take you so far. So if you want to go to the next level of being able to record audio and produce music and content, then you need a professional studio to do that.
We're joined by Mike and Robin Kinnie. They're the owners of Audio Engineers of Detroit, with us on the Megacast, operating an audio engineering studio and also classes to teach you how to produce quality audio productions in a number of different ways, whether you be producing music, podcasts, or other content as well. They have those classes provided. So you can find more information on aedetroit.com. That is AE, or for audio engineers, aedetroit.com. And so, Mike, when they go to your organization for one of these classes, what can they expect to experience in one of these classes? What kind of is the progression of learning from one of these experiences?
Well, they're going to learn the basics of audio. You're going to learn how to record audio properly. You're going to learn how to operate digital audio workstations, Pro Tools. You're going to learn music production, how to make beats and music theory. We go into music theory, and we also go into sound for film and Dolby Atmos mixing, which is the latest mixing that's out here is Dolby Atmos. And we go into the music business also, where we teach students some music business. But the class that we most proud of is the last class, and it's Entrepreneurship 101, which teaches students how to start their own business. So if they want to do something like we're doing, we're teaching that. So that's a huge plus for the students to be able to, learn audio and also touch on learning their own, opening their own business, and also owning their own audio equipment and personal studio that they can take anywhere that they want.
Yeah, that's what's so great about this business, and what I appreciate so much about your business model is that you're not only providing some of the physical tools, but also the knowledge to the people that are taking your classes, that are going to your studio, of how to do things the right way, but also take it to their own advantage and spread that knowledge. So that's really nice. I really like that with your business. We're joined by Mike and Robin Kinnie. They are the owners of Audio Engineers of Detroit with us today on the Megacast. And just a few more minutes with the two of you before we'll say goodbye today. If people are interested in signing up for a class, or they'd like to support this local company and they need to record a podcast, or they need to record some audio for a book on tape, or they want to record their next great song, how can they get in contact with you, sign up for classes, sign up to book time in your studio?
Well, I will say that if you are interested in joining our class, you should act fast. And that's because our class size is small, so that the instructor can have hands-on time with the students. Like Mike mentioned, they're going to have their own console and equipment to practice on. So we really want students that after they go through the class, they're ready to hit the ground running. And the only way that we can support that is if we keep the class size small. So if you are interested, classes do start in September, a few weeks away, and you want to go to aedetroit.com. If you are interested in studio time, you're working on an audio project, a music project, you're a producer and you're working with an artist, you're doing a voiceover for a commercial, you're working on a film and you're a director, then you also want to visit our website, aedetroit.com. And there you'll be able to contact us and get on our schedule. You know, one thing about the recording studio business is we really run 24/7. So it's like Mike mentioned, by appointment, but we're really flexible based on when the person needs to come in.
We're joined by Mike and Robin Kinnie. They are the owners of Audio Engineers of Detroit with us on the Megacast. And as Robin said, you can find more information and sign up for these classes quickly, though, because they're running out of space at aedetroit.com. Just another minute or two with both of you. Before we say goodbye today, is there anything else that would be important or interesting for audience to know about your business or anything else going forward?
Well, you know, I think that one of the impetus for Audio Engineers of Detroit was that we found that here we are in Motown, you know, where the Motown music started, and there aren't a lot of recording studios, and that's really a shame. And we really want to be part of the next chapter of music production, not only on the microphone, but behind the console, those people actually putting all of the pieces together. And in addition to that, having these classes, our students will be able to join the workforce or start a business of their own where they are working directly with clients. So I mentioned earlier that it's more than a recording studio. We really want to be part of our community's fabric and truly make a difference.
Absolutely.
Well, Mike, Robin, we appreciate your time. Thanks for being with us today.
Thank you.
Appreciate it. Mike and Robin Kinnie, the owners of Audio Engineers of Detroit. It's opened in spring of 2021, provides audio recording services as well as classes, so you can learn a variety of different ways to produce crisp, clean, quality audio productions, whether it be voiceover, whether it be podcasts, whether it be music, anything in between. They can help you out there. Find more information at aedetroit.com, and we appreciate them joining us today on the Megacast. Well, just about 2 minutes left in the show, so I want to go ahead and review one more time where you can find more about the Megacast and about all of our information about COVID-19 and other news and those resources. It's all on our website, civiccentertv.com/coronavirus is where you'll find information on our latest headlines and the top stories each and every day before we go on the air for this show live from 10 a.m. to 12 noon. You can also find links to reputable resources about COVID-19 from the Centers for Disease Control and Prevention. from the state of Michigan, from Oakland County, many of our local municipalities as well here in southeastern Michigan and in Oakland County. Their individual COVID-19 pages are also linked right there. So if you're in the city of Orchard Lake Village, you can click on Orchard Lake Village. It'll take you right to your city's COVID-19 page. Same thing for those over in the heart of the lakes in Keego Harbor and down east of us in Bloomfield Hills. You can find specific COVID-19 information for your hometown as well as the state and at the federal level, all on our website at civiccentertv.com/coronavirus and on civiccentertv.com/megacast. If you missed any of our interviews today, we'll have those posted there later on this afternoon, as well as the full edition of the Megacast. It'll be posted there as well. civiccentertv.com/megacast, where you can also learn more information about all of our partnering stations that have been with us throughout this pandemic, such as 88.1 WBFH, the BIF, as well as Birmingham Area Municipal Access, and our new friends over at My Michigan TV. That's going to do it for today's edition of the Megacast. We appreciate everyone for tuning in and joining us today. Our guests, Dr. Preeti Malani from the University of Michigan, also Alice and Nicole Harrison, founders of Kayla Marie's Hope Services. Karen Olex from Oakland Schools joined us as well, and we appreciate her time. And then, of course, Mike and Robin Kinnie from Audio Engineers of Detroit, as well as the time and the efforts of all of our crew here at Civic Center TV and at the Megacast. Calvin Brown, our studio engineer, in here with me every morning, 10 a.m. to 12 noon. Larry Nyland, our booking producer and our Zoom producer, and everybody else that's involved in producing the Megacast. We'll be back tomorrow morning live from 10 a.m. to 12 noon. This has been the Megacast.